Kidney stones are a crystallization of metabolites within the urine. They look like small pieces of gravel, and they come in a number of different colors. They can be black or brown or indeed yellow, and they vary in consistency from soft stones that could almost crumble in your fingers to very hard stones, perhaps almost as hard as diamonds. They cause a variety of different clinical conditions. The classic one is the awful ureteric colic that people experience, which is this terrible pain in the loin or on the side, stones being picked up as an incidental finding on an X-ray performed for some other symptom. Increasingly, the latter presentation of what we call asymptomatic stone is increasingly common with the amount of imaging that patients are having performed for other conditions, and we're seeing more and more patients presenting like that. In addition, stones can cause urinary infections, blood in the urine, intermittent pain, which isn't as severe as the colic that I've just described. What are stones made of? Well, the commonest type of stone is a calcium-based stone, and the typical and the most commonest in the UK is a calcium oxalate stone. The other types of stone are calcium phosphate stones, and then the uric acid stones, which are on the increase related to metabolic syndrome and insulin intolerance, and then the more uncommon stones such as the cystine stone, and the other type of stone is what's known as a struvite stone, which is magnesium ammonium phosphate type stone, and these are associated typically in patients who suffer from recurrent urinary infections, and typically a middle-aged lady may be particularly susceptible to this, and these predispose to formation in the type of staghorn configuration where the stones can occupy the whole of the collecting system of the kidney. Patients at particular risk of suffering from stone disease are those who have a family history of stone disease. There are some very rare conditions such as cystinuria, which is a condition where patients are predisposed to stones because they have what's known as an inborn error of metabolism. But that's a very rare condition. Interestingly, the vast majority of patients have no obvious cause for their stones, the so-called idiopathic stone former. And in fact, it is thought that 8 to 13% of the population will suffer an episode of stone disease during their lifetimes. So unfortunately, we're all at risk, but those at particular risk are those with family histories, those in very hot climates who are predisposed to dehydration, and those with particular metabolic problems that can predispose to it. The interesting thing in certainly the Western world and in the UK is the increase in obesity is really leading to a stone epidemic at the moment, and that is thought to be due to a condition called insulin intolerance, and this leads to a change in the acidification of the urine, which predisposes patients to a particular type of stone known as uric acid stones, and these are really on the increase at the moment.